With 224 publications in peer-reviewed journals, Dr. Gittelsohn has led multiple food source-centered intervention trials aimed at improving the food environment and providing skills and nutrition education needed to support healthy food choices in the martial lands, in American Indian communities in Baltimore City, and for Native Hawaiian communities. Dr. Gittelsohn developed a multi-institutional program for diabetes prevention in 7 First Nations in schools and food stores, which was extended to 5 American Indian communities. OPREVENT? OPREVENT. So it's a fancy word. I don't know the definition of. It included worksites. So what is OPREVENT?
You'll hear all about it.
Okay, good. See, it's a preview. He's currently implementing a multi-level program for child obesity prevention in Baltimore City, working with policymakers, recreation centers, cornerstones, carryouts, and families. These programs have shown success in increasing knowledge, healthy food purchasing, and consumption of healthy promoted foods at the consumer level, and reducing obesity and improving stocking and sales at the retail level. And just to remind you, we've added some time, so if you're you've got it. So I'll leave it to you. Thank you.
Thank you. Thanks for the introduction. Actually, this was supposed to be a dual presentation with Marla Pardilla, but about 2 hours ago I found out she's come down with the flu, so she's unable to be here today. So you're left with me, and we're supposed to do a brief presentation of the history of our collaboration, so I'm still going to do that for you. So we're going to talk about our collaboration. I'm going to talk about the food environment situation in Native communities. The previous speaker spoke to that effect to some degree. I'm going to talk about some strategies for changing or improving the food environment, and then focus on our work in trying to improve the food environment through several projects in Native communities. So Marla and I have, I'm really sorry that she can't be here today to say this, but Marla and I have been working together for, we're not quite sure, but we know it's at least 20 years, and we were both co-investigators in the Pathways study, which many of you have probably heard about. Was an obesity prevention program in 7 American Indian communities that ran from 1991 through 2000. She worked with me on the Navajo Healthy Stores project from mid-2005 through 2011. She worked on OPREVENT, which you just had a brief introduction to in the last 5 years, and we're currently working on yet another project together called OPREVENT 2. And I'll say a little bit more about all of these projects, except for not too much about Pathways. This collaboration has taken many different forms. One of the greatest parts of this collaboration, I would have to say, is the notion of figuring out how to communicate and work with tribal communities. This encompasses an incredible amount of different aspects and pieces of the work. It's impossible to say how many different things that she has taught me over the years. It's included things like presentation to communities, obtaining letters of support, tribal resolutions, navigating tribal and Indian health services, institutional review boards, and many, many other different things. We have been productive in a scholarly way as well. We've had 7 papers together as co-authors. Here's one of them. And I'm really pleased that she led a paper as the first author that dealt with the issue of high levels of household food insecurity in the Navajo Nation. So it's been a very productive collaboration and partnership that's lasted over 20 years. And again, I'm sorry that she can't be here to share this stage with me and to present on our joint work together. So what's the story about the food environment and obesity? I'm going to give a somewhat simplified version of this story, in fact, hugely simplified version. But essentially, a lot of studies have looked at the relationship between aspects of the food environment, food sources, and have seen different kinds of relationships such that the fewer the supermarkets, the more obesity that you see. The greater distance you have from where you live to a grocery store, the more obesity. And the kind of food source really makes a difference. Supermarkets are protective, but convenience stores and fast food outlets are risk factors. So in addition to this, we see that disadvantaged minority populations have really the least access to healthy foods, and this is not just American Indian communities, but African American, Hispanic, and many other communities. What about the food environment in Native communities? Well, if I had to make a few generalizing statements, I'd say that, again, Native communities tend to be rural and remote with little or no public transportation. They tend to have very low access to supermarkets on reservations, and so as the map that the previous speaker presented, there are very high rates of what we call food deserts in American Indian communities. On the other hand, there are a high access or very high numbers of gas station stores, trading posts, fast food restaurants, which, because of the lower availability or access to healthier foods in those settings, could be termed those areas using the term food swamps. And there's also an emphasis and evaluation of traditional foods. Here's an example of a supermarket on one of the American Indian communities that Marla and I work together with. And just because you're a big store does not mean it only leads to increased access to healthy foods. This is the stacks and stacks of Spam and Vienna sausages and that sort of thing. So supermarkets are protective because of the healthier foods they can make available, but they can also make a heck of a lot of unhealthy foods available too. A trading post, a gas station store, a little vendor, in this case it's mutton. So how might we go about changing the food environment in these kinds of settings? And we've been working on this area for well over a decade, closer to a decade and a half. One way to think about doing this is this notion of changing access to foods within stores, within retail food stores, by decreasing the availability of unhealthy foods or increasing the availability of healthier foods, especially in small stores that don't carry those foods. It can be about changing the physical location of foods within stores, so store layout or renovations. It could be about manipulating price, so making perhaps the less healthy foods a little more expensive, possibly to offset decreasing the price of healthier foods. We can talk about changing access to foods at somewhat of a higher level within neighborhoods or communities by building new supermarkets, developing farmers markets, and other kinds of approaches. We can think about changing, as a means of changing the food environment, changing the setting for the provision of information, and we call this point of purchase or POP promotion, so catching people just when they're about to make that decision about what foods they're going to eat for lunch that day, or shop for their family's dinner that evening, or perhaps for their family groceries for the entire week. There are, of course, many, many other ways: improving food networks, the distribution of food, getting the food from local producers for local consumption, improving local production of foods, increasing the nutrient content of foods, working with restaurants, many other approaches to changing the food environment. And of course, there is policy. And we're going to touch a little bit on that part of it near the end of this presentation. So influencing policy could be, it doesn't have to be tribal legislation, but it could be legislation at the tribal level. It could be worksite policies. It could be school policies. It could be empowering community members to work with the food sources to make requests and to know that they have an ability to shape their own food environment by changing the foods that the small stores, for example, might actually offer. So been working for a good period of time in Native populations, and this is a series or a sequence of different projects that have taken place. We can only touch on a few of these in this particular presentation. So I'm going to start off by talking about a project called Apache Healthy Stores that took place in the early part of the year of 2000 through 2005. And the goal was to work with 2 Apache reservations, changing the food environment, and partnering with communities there all the way from planning to evaluation. We worked with the San Carlos Apache and White Mountain Apache tribes. And the goal was to implement a retail food store-centered nutrition program on the White Mountain and San Carlos Apache reservations to increase access to and sales of healthier foods in those food stores, and to increase healthy food preparation, purchasing, and the diets of community members. So in all of the projects that I'm going to present about, a big aspect of this work is a start with a lot of community engagement. One of the main approaches that we use in Apache Healthy Stores is something called community workshops, where we invite a variety of different community members and allow them to shape and decide what foods should be promoted, how these foods should be promoted, what kinds of messaging and slogans and so forth should be included. Apache Healthy Stores was decided through this community workshop and formative research process to take place over about a year or a bit longer, and involved 5 or 6 different stages, each about 2 months long. And these are some of the posters. This is the logo. You can see at the upper right that there's a photograph of one of the supermarkets that we worked with, and there's a big banner inviting people to look for or select foods that are marked with this particular logo. So we had shelf labels to identify some of the healthier options in stores. In this case, it's showing examples of shelf labels that were indicating a healthier alternative that was lower in fat than a less healthier alternative, or a food that was lower in sugar, that sort of thing. And we complemented this type of point of purchase promotion with interactive sessions, in this case taste tests, where people got to sample some of the foods that were being promoted in a particular phase. The stores were very much on board. The larger stores, in fact, donated more than a shelf space, an end cap, and this is kind of a very strong indication of their level of support of the project. We worked with local artists who wrote a series of cartoons that were published in one of the local newspapers in both communities that took a fictional family and had them shopping for healthier foods and making life decisions. There were a series of culturally themed radio announcements. Both communities had radios that serviced those communities in both Apache and in English. And the evaluation of the program was a quasi-experimental design where half of the White Mountain Apache tribe roughly and half of the San Carlos Apache tribe were divided into intervention and comparison areas. And the stores in the intervention areas received the program. The stores in the comparison area did not. And then we had a sample of people who were the main food preparers and shoppers of each of the household in each setting, and we interviewed them both pre and post. We assessed the program in terms of process indicators, how well the program was implemented according to plan at several different levels, including at the individual level, the store level, and the community level. And we also assessed exposure to the program. So just a few quick results. The blue bar represents the intervention areas, or respondents who lived in the intervention areas. The red bars represented the respondents who lived in the comparison areas. And we saw some significant increases in the frequency of purchase of low-fat milk, fruits, and vegetables. We also looked at diet, and we saw increased purchasing of low-fat milk and healthier cereals, and actual decreased in purchasing of some of the foods that we had hoped would be, decreased consumption of some of the foods we hoped would be consumed less frequently, including ramen noodles, whole milk, and fatty snacks. So I didn't present all of the results of this particular trial, but we found that this food store environmental intervention was associated with modest improvements in food-related knowledge, healthy food purchasing, gram consumption of healthier food options, and again, I didn't present this, but we saw increased unit sales of promoted healthier food options. And to my knowledge, it was the first food store intervention to show impact actually on diet. So with this initial successful, I guess you'd say pilot trial, we thought to expand this work a little more broadly and in a larger scale. And we implemented a project called Navajo Healthy Stores. But this had a somewhat different focus than the Apache Healthy Stores program, in that part that was similar was that, again, it was working to change food sources, retail food sources. But something that was quite different was that a greater emphasis was placed on sustainability. So Apache Healthy Stores really was Johns Hopkins hired staff, and although they were from the community, hired staff who implemented the program. This case was different for the Navajo Healthy Stores project. And here's a picture, a map of the Navajo Nation. These green dots represent healthy food stores, so food stores that have a high healthy food availability index. The yellow dots represent modest or moderate healthy availability of healthy food, so probably in the trading post type. So the green dots probably are supermarkets. The yellow dots are most likely trading posts or medium-sized stores. And then quite a lot more of the red dots, and the red dots are gas station stores, convenience stores, and the like. And essentially, we created a series of regions surrounding different stores or clusters of stores, and these were each randomized to intervention or comparison, I should say, to delayed intervention. And the goal of the project was to reduce risk for obesity and other diet-related chronic disease by increasing the availability, purchase, and consumption of healthier foods on the Navajo Nation, and to implement a self-sustained, and I want to underline that word, self-sustained healthy food store program on the Navajo Nation in collaboration with local Navajo stakeholders and others. And of course, we wanted to evaluate the impact of the program on obesity and other outcomes. Just like in the Apache Healthy Stores project, we started with a series of planning workshops. We had 12. The Navajo Nation is very large, and so we did these workshops in many different parts of the Navajo Nation. And this gives you some idea of the makeup of the people who participated in these workshops. Just like in Apache Healthy Stores, through this process, we came up with a multi-phased intervention plan where different foods were emphasized. The stores were asked to stock different kinds of foods. There were interactive sessions that focused on different subtopics, and these were all of the focus of different, roughly 2-month-long intervention periods. The big difference about this program, I think, and I think this is quite key, was that it was actually implemented by nutritionists and community health workers who were affiliated with the Navajo Special Diabetes Program. So this was not, I'm not saying I never went into a store, but this was not implemented by myself or the Johns Hopkins team or people who were hired by the Johns Hopkins team. We did provide training. We did provide materials. We did do the evaluation. And so the goal was a sustainable and successful, of course, successful program. In terms of working with stores, for each phase, the store was encouraged to stock 3 to 4 new, healthier foods or beverages per phase, and we provided them lists of those foods, again, based on the suggestion of community members on those foods to stock. We did shelf labeling. Again, we did interactive sessions in the stores. This is just a photo of some of the training that was done with the community health workers or the nutritionists from the Special Diabetes Program. And this is just a sampling of some of the materials that were developed. These materials are actually available from me, or we have a website where you can take a look at some of them, but you can get a hold of the Interventionist Manual of Procedures for this project, and that gives you actually pretty much a sampling of every single material that we developed. Here's some of the nutritionists and community health workers actually in the store doing this work. Again, we evaluated in terms of process how well the program was implemented according to plan. We assessed impact at the store level and again at the consumer level. Okay, so I'm going to show like 3 or 4 tables. I apologize, they have a lot of numbers. This is the table that I was hoping was going to make my day. Right? At the end of the project, you look and you want to see, oh, there should be, this is change in all of these different factors: knowledge, self-efficacy, label reading, healthy cooking, how often they cook foods using healthier methods, perception of healthy foods, BMI. And we saw no significant change, although something came kind of close for BMI. So depression set in there. And all of this time, all of this energy to implement this kind of program and no significant impact. What do you think happened? Or what would be your guess? Yeah. You raise a good point. Yeah, it's possible that we undertook too many different foods. That's a possibility, but that's actually not what I think happened in this case. Other thoughts about what might have happened? Yeah. Change is hard. I mean, when you see with most weight loss programs that people who are successful initially frequently go back to old habits. But let me share with you what I think happened. So this is exposure to the program in the intervention sample and the comparison sample. We asked them, did you see this poster? Did you see that poster? Did you do this taste test? Did you get this free gift? Did you do this interactive session and so forth? And what we saw was that although our intervention sample had greater exposure to the intervention, our comparison sample also had a lot of exposure to the intervention. And that's because we're working it's a very large reservation but it's all one reservation. Everything's contiguous. We couldn't tell the person from this community, don't shop at that store. We couldn't say from the people over here, you can't shop at those intervention stores, you're the comparison sample. So a lot of people who were part of the comparison were exposed to the intervention, and a lot of people who were part of the intervention undoubtedly shopped at some of the comparison stores. So what we did was we changed our approach, and we divided it up by level of exposure to the intervention. And here we saw what I kind of was thinking we would see, or I guess we hope you will see, which is that the people, if you look in the second from the right column, the people who were most exposed to the intervention, the people who said that they saw they participated, they saw everything, they heard the radio announcements and so forth and so on, those were the ones who had a far greater possibility of changing. And there was great statistical significance in this analysis. And then when we did it after adjusting for a variety of factors like age and education and sex and so forth, again, it held true. The people who were most exposed to the intervention improved their food intentions. They cooked more healthily. They bought healthier foods, and their BMI went down. So this is sort of a lesson that I've learned in terms of doing community-based work, is that it's very difficult to create this idealized, randomized, controlled trial type situation. But the conclusions were that the Healthy Stores program on the Navajo Nation was successfully implemented and was associated with improved BMI, so body mass index, psychosocial factors and behaviors among those who were most exposed to the program. So this led us to think about the next project. And the next project, which is OPREVENT, is what I call an enhanced multi-institutional program. And I've always worried about just working in one venue in the community, food stores. I'll have to say that I mentioned earlier that Marla and I got our start and first met each other working on a school-based program. And those also have their issues, because the kids, no matter what you do in the context of a school, if kids leave the school and go out into the community, and the unhealthy foods and so forth are just as readily available, then everything that you do in schools is undermined. The same thing can be said, though, of course, about working in food stores. If you change what's happening in food stores, and if you don't think about schools or think about the other venues that people acquire food, then your work potentially, or the work in the community, is potentially not going to achieve what you hope it will achieve. And so the idea here was, well, let's work in multiple institutions at the same time. So the goal of OPREVENT is to develop, or was to develop, an effective obesity prevention program operating at multiple community institutions. What does OPREVENT stand for? And the answer to the question from the very beginning, it's an acronym. And you can see why we say OPREVENT, because it stands for Obesity Prevention, Research and Evaluation of Intervention Effectiveness in Native North Americans. I like OPREVENT. And it was a program that combines communications, school, family, food store, and worksite components for obesity and diabetes prevention. The rationale, it's better to engage community members in program planning and implementation, again, using that kind of community workshop approach that I've already described, to work in multiple places to reinforce healthy messages and increase exposure, to change the environment to increase access to food and physical activity, to reach people at the point of decision, and to plan for sustainability from the beginning. We worked with actually it's 3, because in the end, Mescalero Apache did not join the project. We worked with 3 communities in New Mexico. We worked with 2 communities in Michigan. Again, we did this process of community workshops that I've mentioned already. And again, we ended up with a program that was implemented over a series of phases, each phase 2 or roughly 3 months long. Here are some of the posters that were developed for this project. Again, cooking demos and taste tests, so these are things that happen in food stores. And something that was different from what I've described before was a 2nd through 6th grade curriculum was developed that focused on changing family eating and physical activity habits. It included a storybook. This was for grades 2, 3, and 4. and included things like exercise breaks and physical activity. It was very Pathways-esque, for those of you who know Pathways. It was very Pathways-esque in the way that it was developed and the way that it operated. But a big central component of the school program was the kids will take this information home to their parents. They will act or potentially could act as change agents within the household. Here's a sample page from the 4th grade storybook. I'm not expecting you to read it, but just so you can see there were illustrations, and actually was quite a engaging and popular component of the project. We also worked in local community worksites that had 5 or more community members employed in the worksite were invited to be part of the worksite program. And this particular project, part of the project, emphasized increasing physical activity. A number of different things were done, but this included pedometer challenges. There was community media and giveaways as part of the project as well. And the big idea, again, is that you have reinforcing programs that happen at the same time. So children might be learning about healthy snacks as part of the school program. They would then encourage their parents to purchase those healthy snacks. Parents go to the stores and see signage and perhaps do a taste test during the interactive sessions within the stores. The adult workers hear about healthy snacks on the job as part of the worksite program. And all families hear these messages through a variety of different community media. I won't go into any specifics of these numbers, but just to say that we collected quite extensive process data on how well the program was implemented according to plan. And these are some preliminary results. We're still actually in the analysis phase of this work, but we did not see an impact on BMI or weight, although we did see a trend for reduction in BMI in men that was close to but did not achieve statistical significance. What we did see was a reduction in waist circumference for our intervention versus comparison communities. We saw that the waist circumference change was associated with changes in percent body fat, which we felt was a hopeful finding. And we saw also in terms of exposure, those, again, especially those who were most exposed to the intervention, showed the greater change in waist circumference. We did not see an impact on physical activity as part of the project, at least using the instruments that we used. And we saw trends towards improvements in knowledge, self-efficacy, and intentions, and our dietary analyses are underway. So we've learned a lot of lessons from this particular project. This was quite a complex and challenging intervention to implement. We're working in so many different places. It's easy to spread yourself very, very thinly, and it's very costly. Sustainability is a huge issue because it's obvious that no single entity is going to take on a school program, plus a worksite program, plus a food store program. So we think part of the issue of not seeing as many of the results that we had hoped to see was that we needed to increase the intensity of this intervention, that we needed to focus, of course, more on physical activity, and we thought it would be important to begin to work at the policy level, whether that's at the worksite policy level or perhaps at the tribal policy level. Here's the OPREVENT, the original team. It changed a lot over the years, but some of the people who were on that team, Jackie, I see you, are around here today, and Brittany. So we've started a new project. It's called OPREVENT 2. I'm sorry, that's not a very creative name. But we actually had quite a lot of name recognition from the original OPREVENT that we decided that it would be better to keep that, even though we were working in new communities, we thought it would be better to keep that name, or at least a version of that name. And again, what this is about is refining and repeating the school, food store, and worksite and community media interventions in 6 new American Indian communities in New Mexico and Wisconsin, but adding additional new features, including a policy component and a social media component, and enhancing the physical activity piece of the project. We're working with tribal members, tribal policymakers to support, develop, implement, and enforce policy at the tribal and institutional levels. And of course, there's a lot to be said about how this policy piece, we're just a year into the project, so the actual way that this policy piece is going to play out is likely to take many different forms from community to community, but this potentially includes capacity building, community action coalitions, and other approaches. I just wanted to say that I mentioned before that there's some refinement of the original, or maybe out-and-out changes of the original project. We're doing a series of community member, teacher, and policymaker workshops that are underway nowadays. And one of the things we do is we show them the old materials and ask them to respond. So here's an example of a label, a shelf label. It says higher in fiber. And we ask people to respond, first to give it a score. 0, it's awful, get rid of it, we don't want to see this ever in our community. 5 means it's perfect, use it as is. And then various gradations in between, and to write down their comments. And so this is actually a very well-liked shelf label. Contrasting with we thought, well, let's see if anybody would be interested in a logo change. So we developed several logos, and this one is getting the boot. So I don't think we're going to use this. But just to give you an idea that, again, and I think this is something unusual, is to have a very formal, from all of the different communities that we're working with, a very formal process for review and commentary and in this case, scoring or ranking of the different intervention materials and the approaches that we would use as well. So in summary, of course, there are multiple challenges to working in Native American food environments. I believe that multi-level, multi-component interventions are needed in these settings. We've shown that interventions to improve the food environment, especially retail food stores, have been successful in improving access and consumption of healthy foods and reducing obesity. Community engagement at all of the different levels of these kinds of projects is key, and we need to expand and figure out ways to expand this work. We need to be flexible and work with various institutions and media, including new media. 5 years ago, I probably considered some social media, but it hadn't had the same level of penetration that it has nowadays. And nowadays, it's fairly ubiquitous, at least in the communities that we're working in. And of course, we need to enhance sustainability. We need to work with policymakers. So I want to thank you and see if there are any questions.